perform passive physiological intervertebral movement in the thoracic spine for either assessment or treatment. I'm going to have my patient sitting as close to the edge as possible, and my body's going to snuggle in. There will be no room between the two of us. They're going to feel very comfortable, like I am in control. From the front, they're going to have their arms crossed in a V shape, not a W. One arm under the other. And then, in my case, where I'm a small person with short arms, and I'm a female, I'm going to get them to lift both their arms up, and I'm going to come underneath so I can get my arm all the way around. For some people, especially males, who have longer arms and don't want to have their arms directly on a female's chest, they instead will ask the person to lift up one elbow, go between the two elbows. So Greg, I'm going to get you to cross your arms. Good. And then I'm going to get you to lift both your elbows up. I'm going to come around, and then you can drop your arms back down. My pinky is going to create an axis at the level that I want to assess and or mobilize. My other hand is going to palpate and or induce force. Palpate for assessment, induce force if it's treatment. So in this position, I'd have the option to flex that segment, extend that segment, side bend that segment away from me by doing a scoop-like movement. I can side bend towards myself if that's the technique I want to perform, though it's a little bit harder for me. I can only rotate towards myself. So let's do a technique to increase his extension on the right at the level where my hand is. I've put my thumb out towards the transverse process. I'm going to hinge for extension, side bend towards myself, which is unilateral extension on the right, rotate to the right, and in this position, I can now do more rotation as an oscillating PIVM, more side bending as an oscillating PIVM. I can do more extension as an oscillating PIVM. I can induce a superior glide of the inferior while I perform a little bit of extension, causing an inferior glide of the superior facet. Or I could do a muscle energy technique in this position. Greg, don't let me rotate, match my resistance as I try to rotate him to the right. Then I ask him to relax, and I'm going to take up all my components of extension, side bending, and rotation to the barrier. And that's how you perform PPIVM in the thoracic spine.